So I'm presenting the Roman trial, a randomized phase 3 trial of testing Avasopasem manganese against placebo in patients who are receiving concurrent cisplatin and IMRT for their head and neck cancer, with the goal of decreasing severe oral mucositis. Some brief background information as to the clinical setting for this drug. So severe oral mucositis is a very common side effect in patients who are receiving radiation and concurrent chemotherapy for their head and neck cancer. It is debilitating and painful, and it's a difficult side effect for us as clinicians to manage. It can result in patients needing a feeding tube placed. Sometimes they need to be hospitalized or get treatment breaks, and of course that can impact their cancer outcomes. Unfortunately, there aren't any FDA-approved drugs to mitigate this side effect, and so we're excited that this drug, Avasopasem manganese, is showing significant promise. So it was tested in a phase 2 trial, and those results are previously published in JCO in 2019. And the drug showed significant benefit in decreasing the incidence and duration of severe oral mucositis, and showed a decrease in severity of the oral mucositis as well. Importantly, the tumor outcomes at 1 and 2 years were not significantly impacted and were equally good to the placebo arm. So I'd like to tell you a little bit more about the drug itself. The mechanism of the drug is such that it rapidly converts radiation-induced superoxide to hydrogen peroxide. And this is important because superoxide is what causes the downstream events that result in the development of oral mucositis. And in the basic science studies, and now in several clinical trials, we have shown that the mechanism of this drug protects normal tissues from the radiation effects, but does not spare cancer cells from the damaging effects of radiation. And this drug was tested in a randomized placebo-controlled trial at 2 dose levels, 30 milligrams and 90 milligrams against placebo. And the important outcomes of that trial were that the severe oral mucositis was significantly decreased in duration as well as incidence. The severity of the oral mucositis was also decreased, and the benefit was greatest in the higher dose of the drug, the 90 milligram arm, and so that was brought forth for phase 3 testing, and that is what is being tested here in the Roman trial. So the design of the Roman trial is such that oral cavity and oropharynx patients that were otherwise going to be receiving concurrent cisplatin and IMRT were enrolled, and the drug was delivered as a 60-minute IV infusion prior to each radiation treatment. The patients were stratified by their surgical status as well as the dose of cisplatin that they received, and ultimately we enrolled 455 patients on the trial. The data that we presented today was the intention to treat analysis of 407 patients. The patient characteristics were such that the characteristics were well distributed between the 2 arms. The most common patient presentation was a P16 positive oropharynx patient receiving definitive chemoradiation on the weekly cisplatin schedule. Importantly, every patient enrolled on this trial was required to receive 50 gray or more radiation to 2 oral cavity sites. And if we look at the patients that were enrolled, 50% of these patients actually received that dose or more to 5 or more oral cavity sites. So we were really expecting a lot of mucositis in this patient cohort. And we're pleased to announce that the trial met its primary endpoint of severe oral mucositis incidence by the end of IMRT. The AVA arm significantly decreased the incidence from 64% down to 54%. This was a p-value of 0.045. Importantly, the drug also statistically and significantly decreased other important clinical endpoints, like the duration of severe oral mucositis. It impressively decreased the duration from 18 days down to only 8 days. This is a relative decrease of 56%. and also decreased the incidence of grade 4 mucositis and the duration of grade 4 mucositis, though those did not quite meet statistical significance. The active arm also decreased and delayed the onset of severe oral mucositis during the treatment course from 38 days in the placebo arm to 49 days in the AVA arm. As we looked at the drug against placebo as far as adverse effects, the adverse effects incidents were similar to what we otherwise expect in cisplatin and radiation patients. And there is a known mild side effect, grade 1 to 2, nausea and vomiting with the active drug, but this was self-limiting and resolved on its own within a few hours after the infusion completed. This did not translate to an increased incidence of grade 3 nausea or vomiting compared to placebo. So we're excited to present today that this is a positive trial, that the primary endpoint of severe oral mucositis incidence was statistically and clinically meaningfully reduced with AVA 90 milligrams. We also decreased the duration of severe oral mucositis, decreased the incidence of grade 4 mucositis, and delayed onset of severe oral mucositis. And thankfully, the safety profile of the drug is very similar to that of placebo. The results that we presented today were very similar to the results already published by the phase 2 trial results in JCO 2019. And we look forward to following these patients for their 1- and 2-year tumor outcomes, and we'll subsequently report that data as it comes available. We're also exploring whether or not the drug may mitigate cisplatin-induced kidney injury. And we are excited because the company is moving forward with the FDA submission, and so we hope to hear more about that later this year as well. This will have a significant impact on our patients' quality of life. If we can decrease the severity of the ulcers that develop in their mouths and throats during the treatment course, that may decrease how many doses of the narcotics they need to take. It may decrease the incidence of having a feeding tube placed. They may return to a normal diet faster and may return to a normal life faster if we can decrease this awful side effect from radiation.